realize right off the top, an awful lot of this is healthcare, because we have so many rural hospitals in Montana, and we're so spread out in Montana. We're not like, Colorado or, like in other states in the west of the big major city, but we're all spread out. And add to that, we're a farm and ranch state to a large degree. We're agriculture, we're very agricultural. And a lot of people who work on farms and ranches and don't have insurance. I was raised on a ranch. I mean, I've seen guys get mangled up with tractors and all kinds of accidents and so forth, and it's tough. They don't have insurance. It is tough paying the bills. It's not a bad thing for me. I'm just going to do what I can to help. And we did a lot of rooting around, talking to people and so forth. And at the same time, because the problems are so acute in Montana, there was an administrator. His name was Brown. I've forgotten his first name. And he just said, Max, this is just, we're disadvantaged. Our small rural hospitals just can't make it. And so he has applied for a waiver, a Medicare waiver. It's good. We helped him get that waiver, and he got the waiver. And so for a couple, 3 years, Montana small rural hospital would get that waiver. But it was so important, it was so logical, and it's a right. It's the right thing to do. That I said, well, let's get that legislation. And
was that waiver the medical assistance facility?
Yeah, MAFs. Yeah.
Yes. Okay.
Right. So then we got that into law, but then it was recategorized as a critical access hospital.
Mm-hmm.
The CH, and that's in the law, is to help rural hospitals, and it made a big difference to rural hospitals. Otherwise, they're just having a real hard time. Mm-hmm. But at the same time, too, Medicare and Medicaid reimbursement is extremely complex for both hospitals, for doctors, and insurance companies, and it's mind-numbing. But one of the problems is that because healthcare costs were going up so high, generally for the country, then Congress enacted something trying to control costs called prospective payment. And under prospective payment system is something called DRGs, and lots of different categories for what hospitals do or don't do, and they get reimbursed X amount of dollars for this DRG and Y dollars for that DRG, etc. The trouble is, it was geared toward large hospitals, it was like the law of averages. It's just across the board.